Well, as people started to get sick with COVID-19 over 2 years ago, we learned about some lingering symptoms, loss of taste and smell. Eventually, we learned people were dealing with losing those senses long term. Today, I spoke with a local ear, nose, and throat doctor who talks about what can be done to recover and an additional condition that's affecting more than your senses. There's nothing like the smell of your favorite scent or a taste that takes you back.
We call our sense of smell one of the most primitive of our senses because we've all gone through the experience when we smell something and it immediately takes us back to a memory.
Dr. Sean DeMars, an ENT with Cadleck, says even months after recovering, some people are left with the lingering symptom.
Smell and smell problems is one of the hallmarks of the disease.
Dr. DeMars says the nerve endings where smell is detected aren't well protected.
Those nerves right in that area become infected to the point to where they start to swell, they start to lose their function, and then sometimes those nerves actually die,
causing loss of smell and taste. Even worse, Dr. DeMar says some people are living with parosmia.
Instead of smelling normal things, they will smell smoke is one common complaint, dead material, kind of rotting flesh, that rotting kind of smells are also very common complaints.
Dr. DeMars says it takes work, but there's hope for recovery, and it comes in the form of smell therapy,
where you do physical therapy for your nose, and you pick multiple different scents that are familiar to you. You focus on what you're smelling so that you try to retrain your brain that that's what you're smelling.
He says they're also concerned about the well-being of people living with parosmia, from weight loss to emotional health. He hopes people living with it seek help.
Because a lot of us actually receive a lot of enjoyment from eating. And if you take that away, it can cause a significant amount of grief and even depression. The majority of patients at least have some return of sense of smell.